Hello, this is Grace again. You have already watched part 1. This is part 2 of breast reduction. At this point you feel this is the right procedure for you, you are comfortable with the surgical team, and your insurance has approved the procedure. You have a surgical date. Part 2 will help you get ready for surgery. As you prepare for surgery, there are a number of important tasks you must do. The first is that within 30 days of your surgery, you must make an appointment to see your primary care doctor. Your medical doctor will need to perform a thorough history and physical, and complete a form that states you are cleared to have surgery under general anesthesia. It is best that you arrange this appointment as early as you can, within this 30-day period. Please don't wait until a week or two before your date of surgery to meet with your primary care doctor. Our nurse and anesthesiologists will need the time to review this form before the surgery, to avoid cancelling your date for surgery because of an unexpected medical concern. Please also bring a paper copy of your history and physical with you the morning of surgery. Ask your primary care doctor to print the report for you. Another important task to focus on is to improve the quality of your breast skin, where the incisions will be made to reduce infection and optimize healing of the incision. We suggest washing the breasts daily with mild soap and water, especially concentrating in the areas under the breast and crease where the skin may be irritated. It will be helpful to make sure that any moisture is removed with dry pads and air, so as not to irritate or macerate the skin. Please use a skin moisturizer often so that the skin is not dry but soft and supple. It is important to have what you need after the surgery, before the surgery. You will receive instructions at the time of your preoperative appointment. Our nurses will help you with the surgical bra and the sports bra. At your local pharmacy, you can purchase ibuprofen and acetaminophen. We recommend purchasing both, as both work together in helping to control the pain and discomfort after surgery. You can purchase a mild laxative, as constipation can occur from lack of mobility after surgery. If you are unsure how to take the medications, please ask your pharmacist and our surgical team. You will also get prescription medications. Also, we recommend that you purchase a silicone tape. Silicone tape can help control the healing of the incision and the scar. You can find inexpensive silicone tape products online. The operating room staff will contact you the day before your surgery, and tell you what time to come in for surgery. They will give you instructions on when to stop eating and drinking. This is for your safety as you will be under general anesthesia. You will also be given these instructions at the time of your preoperative appointment. Please follow all instructions. If you are unsure, please ask. Also, it is very important to make sure that we have all of your current contact numbers, and please answer the phone when our staff call you. If our staff is unable to reach you, then your surgery will automatically be cancelled. This is because of the complexity of running a busy operating room schedule, with many patients who are critically ill and needing surgery. The night before your surgery, please thoroughly bathe and wash your breasts and body with soap and water. After the soap and water, you are asked to use a special antibiotic wash, called chlorhexidine wash, that will be given to you by our nurse. Washing and then applying special antibiotic soap is to help reduce infection. While breast reduction surgery is an outpatient procedure, it is important to be prepared to pack a suitcase for overnight stay. Please make sure that you have taken plenty of fluids the day before surgery and nothing after midnight. Please follow all instructions, and please ask questions. Please go to bed early and come early to the hospital. On the morning of surgery, please wear loose comfortable clothing, such as loose front closing blouse or shirt. Our nurse will give you special instructions on drinking fluids the morning of surgery, so that you are not dehydrated. Our anesthesiologists recommend Gatorade because it helps to increase your comfort before surgery and to decrease your nausea after surgery. The carbohydrates and minerals in Gatorade will help reduce your body's stress response to surgery. Follow the instructions as to the type of Gatorade, and how much and how many hours to drink the Gatorade before your surgery. Also, please come earlier than when you are asked to come in. Please be prepared for the unexpected traffic and weather. If you are late, the surgery may need to be rescheduled because of the availability of the operating room is not completely under the control of your surgeon. On the day of your surgery, there are many other elective and urgent procedures that will need to be done. However, our operating room staff will do their best to accommodate if you are late, but may not be able to. We apologize if your surgery does not start on time. Be prepared to wait as your surgeon will likely have several other patients who will be undergoing surgery. If there are patients scheduled before your surgery, we ask for your patience. It is often difficult to stay on time because each patient deserves the necessary time it takes for your surgeon to do the procedure they are scheduled for. It is difficult to predict the operating time, but each patient will get the best care possible and your surgeon will be fully focused when it is your turn. The morning of surgery, you will meet your surgeon, the surgical team and the anesthesia team. We are a university hospital, and you will meet our plastic surgery residents, who will also be involved in your care. They are important in helping to make sure you have a good recovery. The surgical team will mark your breasts while you are standing upright. Your surgeon will mark what breast tissue to be removed, and the new position of the nipple and areola before entering the operating room. The surgical team will briefly review the surgery and obtain a consent for surgery. You will meet your anesthesiologist the morning of surgery and will obtain a consent for anesthesia. Please be open in discussing any concerns you may have with the surgical and anesthesiology team. When the operating room staff is ready, the anesthesiologist will wheel your bed to the operating room. You will be asked a number of times the same questions. What is your name? What is your birthday? Do you have any allergies? What procedure are you having today? This is for your safety, so that the entire team can make sure of all details. Your surgery will take 3 to 4 hours, with additional time for anesthesia. Your family will be able to follow on a display screen what stage you in the surgery. We understand how stressful this time can be. They will be able to reach the surgeon and the operating room nurses if they is concerned about the time. As soon as the surgery is done, the surgeon will call your family, and meet them in a consultation room. Your family will be able to see you in the recovery room. When you are taking enough fluids, and your pain is under control, and the nurses feel that you have met the discharge criteria, you will be able to go home with a family member. Only on rare occasions will we feel it is better if you stay overnight. This concludes Part 2. Part 3 is what to expect after surgery. It is very important that you along with your family and close friends watch Part 3 of the presentation before your surgery, so that you are better prepared, and your family and friends can better take care of you. We also recommend that your family and friends to watch Part 3 while you are having surgery as a way of reminding them how best to help you recover. This will give them an opportunity to ask any remaining questions they may have, to take care of you after surgery.